I'm Dr. Morika. Hi, welcome back. Do you remember anything? Okay. Sure. Now you remember falling, okay? That checks out with what we heard. You're currently at the hospital. In the emergency room. Right. Okay, so it definitely seems that there might have been some loss of consciousness. You've been out here for a little while. Can you tell me what led to the accident? You don't remember. Okay, that's alright. So, you arrived this way. We're just gonna go ahead and take care of your head a little bit, okay? What I'm going to do is just take the bandage that they put on there in the ambulance. I'm going to take that off and just take a look at it, and then we'll clean it up a little bit, and I'll rebandage, and then I think we're going to do a few tests, okay? We just want to make sure that you're doing okay. You know, anytime you lose consciousness or you hit the head, we just want to make sure that everything's kind of doing alright. Is that okay? Okay. Well, let me just get a little closer. I'm going to be touching a little bit there. Is that okay? Okay, good. So let me just clean my hands. I will put on a pair of gloves and we will take a look, okay? So let's see. So I've just got some alcohol here. How are you feeling right now? Okay, but your head hurts a little. Okay, that's perfectly normal. Yeah, it's probably gonna hurt for a little while. But we can definitely give you something for that at some point, okay? Okay. Alright, I'm gonna scooch a little closer here then, okay? Just gonna take a little bit look. Okay, don't mind me. Just gonna take that off, okay? It's definitely a pretty good bump up there, okay? A little bit of, something there we'll probably clean up. But not too much. Okay. I think the biggest concern here would definitely be the loss of consciousness. If there are any problems with any of our simple tests, we'll probably do something a little more extensive, but we'll see what happens, okay? I am going to go ahead and get something to clean this up, and then we'll just go ahead and rebandage, okay? Okay, good. Just cleaning up the area. It's just an alcohol prep pad, okay? Try to stay away from the wound itself. We don't want to sting. But we just cleaned up some of the dried blood on the side. So now I'm going to use cleaner for the wound. This doesn't normally sting, okay, but it might just be a little bit just from actual physical touch pressure on the wound itself, okay? Okay. Just relax, okay? Be over very shortly. You're gonna be just fine. There's absolutely nothing to worry about. You're gonna be just fine. Okay. That is good and clean. And then it really doesn't look like it's oozing too much, but I think we're gonna bandage it anyway, okay? Alright, I'm going to put a piece of gauze up there, and then we're just gonna bandage it with a wrap, okay? Is that alright? Good. Alright, so we grab some gauze. Okay. Alright, how does that feel? Just want to make sure it doesn't come into your eyes at all, okay? Good. Okay. So I think at this point we're just going to do a few of those tests that I talked about, just to assess how you're doing, okay? Okay. Alright, the first thing that I have here is going to be okay. So I have this very small little jar. Okay. I'm going to ask that you smell it. Okay, so just take like one small inhale. Okay. Smell. Perfect. And if you want, you can just waft it gently with the hand, okay? What do you smell? Very good. That was lavender. Okay. And I'm going to try to choose scents that are fairly easy to recognize. Okay, another. That one's not coming through the... I try not to take the little thing off just because it gets very potent, but this one's not coming through quite as well, so let's take that off. There we go. Okay. Is that a little better? Good, okay. You can smell that. Good. And what is the scent? Okay. Peppermint. Exactly. Perfect. That one's usually a pretty potent one, so I might have to look at my jars. Okay, another. That one also, I think I'll take the top off of this guy. We'll just do two more, yeah. I think that'll be good. Okay. Take a nice deep breath in through the nose. Good. What are you getting from that? Okay. Lemon. Perfect. Perfect. Okay. This one's pretty strong, so I'm going to leave that top on, okay? Nice deep breath. Perfect. Good job. What do you smell? Cinnamon. Wonderful. Okay, let's do one more and then we'll be moving on to the next, okay? Okay, this one's also pretty strong, so we're going to leave the top on. Okay, good job. Smell. Good, okay. Vanilla. Perfect. Okay. Let's put these away. Okay. So what I'm going to do now is I'm just going to be touching your shoulders and a few parts in your face. I'm going to be doing a few things. I'd like you to just follow my instructions, okay? Okay, good. So I'm going to go ahead and press down on your shoulders. Okay, don't let me press down. Don't let me press down. Good, 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 good. Okay, good. Alright, so I'm going to bring my hands up to your face. I want you to puff out your cheeks. Good. Now don't let me push. Don't let me push. Good, good, good. Perfect. Now same thing for your jaw. Try to open your jaw and I'm going to resist. Perfect, perfect, good, okay. Now I'm going to try and open your jaw and I want you to prevent me from doing that, okay? So, good, 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 perfect, okay. Now we're going to do the eyes, right? So, just let me know if you're uncomfortable. Some people don't really like a lot of things near the eyes, okay? So I want you to close your eyes and then I'm going to try to open them, okay? Good, 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 and the other one, perfect, good, okay. Alright, that's good. So I'm just going to touch there on the side. Alright, and then I want you to just turn your head, okay? Good, and then turn your head again. Perfect, okay? Now I'm going to put one hand here. I want you to try to turn your head into my hand and I'm going to prevent you. Okay, good. Another side. Just go ahead and turn it right into my hand. And good. Perfect. Okay, awesome. Alright, that looks so good, okay? Next thing I think we'll do is I'm just going to take a look at the eyes. Alright. Alright, so I have a light here. Okay, it's kind of bright. I want you to just go ahead and stare right at my nose, okay? Okay, good. Good. Perfect. Okay, to the other side. Okay. Good. And good. Okay, good. And good. Okay. I'm just gonna go ahead and just move this in your field of vision. I want you to keep your head straight and just follow the light with just your eyes, okay? Just your eyes. Just your eyes. Good. And across. And across. Good. And across. And across. Good. Okay. Again, staring straight forward. I'm going to move the light into your field of vision. I want you to just tell me when you can see it, okay? You can just hold your hand up. Alright, are we ready? Good. 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 Perfect. Perfect. Good. Very good. A little over here. Perfect. Alright, that was very, very good, okay? Alright, I'm just going to take a peek into the ears, so I just want you to turn your head. I'm going to check this side, okay? Okay, everything looks clear, eardrum intact. No redness, no swelling. Good. Alright, let's turn to the other side, okay? Good. Okay, everything's good, eardrum intact. No redness, no swelling. Good, okay, good. Alright, everything looks so good. You're doing so well so far, okay? Alright, let me get rid of this tip here. Just put that away. Okay. I'm gonna go ahead. I'm gonna have you close your eyes, and I'm just gonna whisper some things into your ears, and I want you to tell me what those words are, okay? Good. Bicycle. Bicycle, good. Strawberry. Strawberry. Tickle. One more time. Tickle. Good, perfect. Scientific. Scientific. Okay, wonderful. So, seems like the hearing's doing well, the nose is doing well. I do have a little cotton ball here on the kind of the end of the stick. It's got a hard side and a soft side, okay? So I'm going to either touch you with the soft side or the hard side, okay? So I want you, when I do that, to just let me know whether you feel that hard sensation or the soft sensation, okay? Good. So go ahead and close your eyes. Okay, ready. Soft, good. Soft, good. Hard. Good. Just different parts of the face. Soft, good. Soft, good. Soft. Perfect. Perfect. And soft. Wonderful. So it really seems like you're doing very well. You passed all of these tests just fine. I'm just going to do a couple final things and then we'll kind of get you on your way, okay? Everything's looking wonderful so far, so I don't anticipate any further testing, but I'm going to want you to keep a good close eye on yourself for the next few weeks. Make sure there's no changes, okay? Nobody knows you better than yourself, so if there's something that's different, you're going to want to take note and let us know, okay? So, go ahead and open the mouth. So go in there. I'm going to have you stick your tongue out at me, and then just move it side to side. Good, okay? And then the last couple, I want you to go ahead, take your hands, just push them forward towards mine, okay? And then just push against mine, good. And I'm going to pull them towards me, okay, good. resist. Good, 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 good. Okay, good. Okay, I think we've really got it all covered, alright? Honestly, you did absolutely wonderful. There was no concerns whatsoever. However, like I said, you know yourself best, okay? So, no further testing at this time. But I do want you to monitor yourself. I want you to give us a call if you have any problems at all, okay? Okay. Well, you have a wonderful night. I'll let the nurse come back in a few. Okay. You have a nice night. Morika ASMR.